In this unit, we'll work on identifying factors that contribute to substance abuse and understanding the impact of substance abuse on parenting behaviors that may compromise the safety, permanency, and well-being of a child. You'll develop skills in engaging substance abusing caregivers, utilizing screening strategies to determine appropriate community resources, and collaborating with treatment providers to support a viable treatment plan for recovery. You'll also come to value the importance of engaging and collaborating with families on community resources in a strength-based, culturally competent way toward developing and monitoring a case plan that addresses the substance abuse dynamics of the family. To accomplish these competencies, we want you to be able to describe the relationship between substance abuse and child maltreatment. We want you to be able to assess the needs of children and refer them to appropriate resources such as medical care and mental health counseling. We want you to be able to identify common dynamics of substance abuse in families and its impact on child development and safety. We want you to recognize the social and psychological and physiological indicators of substance abuse, as well as to recognize commonly used drug paraphernalia and the substance associated with it. With this, we want you to be able to identify signs and symptoms of the most commonly used drugs associated with substance abuse and child maltreatment. We want you to be able to describe the continuum of alcohol and drug dependency and the addiction cycle. And we want you to recognize the terms and findings of formal substance abuse evaluations, and to be able to describe the different levels of substance abuse treatment and how treatment is determined. To do this, you'll need to be able to recognize the elements of the recovery process, relapse prevention strategies, and the chronicity of substance abuse. When working with families with substance abuse issues, it's important that you be able to formulate individualized, culturally sensitive, court-ordered treatment plan objectives and service activities that address substance abuse issues using strength-based language, and that you're able to assist and support the out-of-home care provider with children's behavior, which may be a result of a substance abuse lifestyle by the caregivers and/or exposure to substance abuse through secondhand smoke, in vitro exposure, or manufacture of illegal substances. Please be aware throughout this unit of your own personal beliefs and biases about substance abuse and persons with abuse problems. Be aware also that families should be involved in decision-making about substance abuse problems. It's important that you draw from strength-based and culturally specific supports and interventions, and that you collaborate with treatment providers and community agencies in an effort to support families and children challenged by abuse issues. To get started, head to the readings and begin learning about this important topic.